in one of the nasal sprays, it might even cause a little bit of swelling in their nose.
Right.
And maybe they're not getting that same effect from a different spray. So generally speaking, if a patient tells me that one doesn't work and they want to try another one, I'm totally not against that. And I think it's totally reasonable to try it because there's not much to lose by trying it.
For sure.
Hello, everyone. Welcome to another episode of We Knows Noses. Today, we will be discussing a topic that some patients ask us about their allergy medication. Specifically, do I need to keep switching my allergy medication if I've been using it for quite a while? So I'll let Dr. Smith start off.
Yeah, so this is allergy season. We're right in the peak here in the Northeast of tree season, given the season change in early April. And so now is when patients start to reach and grab for those allergy medications, either when they go in shopping, at CVS, Costco, Target, wherever they're shopping for their stuff, and they see all the allergy medications in the front of the store. And so a lot of times they come into us and say, hey, I've been taking either this antihistamine like Claritin, Zyrtec, Allegra, Xyzal over the counter for years. Should I switch? Should I change it? There's no great short answer to that question. So we'll talk a little bit about that, as well as the nasal steroids and some other over-the-counter medications, as well as prescription medications that may be added or adjusted. Do you want to talk first about like what you typically say to patients when they ask?
Yeah, so let's first talk about the studies, right? So studies have looked at whether or not these newer generation antihistamine medications, which is a Zyrtec, the Allegra, the Xyzal, and what's the other one? Claritin, right? So is there any difference between any of those medications? And generally speaking, studies have shown no significant difference. Maybe there's a slight edge towards Xyzal in terms of overall effectiveness, but generally speaking, they don't seem to have fatigue with using it. So when you use it long term, there hasn't been shown to be a significant reduction in its effectiveness. And switching from one to the other hasn't really shown to be that useful for most patients.
Correct. Yeah. So what's called tolerance of the medication. So a lot of people think, well, I've been using this Claritin for years and I'm probably not as effective anymore. And the truth in studies suggests that there is no tolerance to these types of medications.
Yep.
However, allergies may change and you may become more allergic to certain things. So the medications may appear to be less effective. Mm-hmm. And truly, one may be more effective for you than another. And so there is some patient preference in it. But the big thing that most of these, as Dr. Reddy said, new generation antihistamines provide is that most of them don't cross the blood-brain barrier very well, get into the brain, and create those sedating, drowsiness, tiredness effects like the older school medications like Benadryl and Atarax and some of the other old antihistamines used to.
Correct. And also, one little thing that we see a lot is that a patient might come in to see us and they've said, I've been using antihistamines for years and years, and it was effective initially. And as time went on, it seems to be not as effective. And you alluded to maybe the allergies are changing and things, or maybe their bodies are changing. But one thing that we see quite frequently is that maybe their sinus issues are getting worse, mm-hmm. right? And the allergy medication might help underlying allergies, but if there's a sinus blockage or a sinus problem that oftentimes can mimic a lot of the allergy symptoms, patients may think that the allergy medications may not be working as well as they were.
Right. So that inflammatory cascade that we've mm-hmm. talked about a lot in the past, this kind of snowball effect that occurs. So like a little inflammation begets a little bit more. And as that snowball effect keeps happening, it can start to slowly over time add up and make those medications appear less active. Yep. So the other medications that often patients are on over the counter are nasal sprays, whether mm-hmm. they're steroids, or antihistamine nasal sprays are a different category, which we've mentioned in the past. Yep. Do you have any suggestions for patients with nasal steroids when they...
Anecdotally, a lot of patients will tell me that one intranasal corticosteroid nasal spray they've tried and it hasn't worked for them, and then they've tried a different competitor brand name and that one's worked, right? I'm sure you've heard this many times.
Of course.
Now, studies have shown, when you look at population studies where people have tried and compared these different types of brand name nasal steroid sprays like Flonase and Nasacort and previously Rhinocort
and
Nasonex, that there really isn't any significant difference between them. But there are some differences in the formulations, right? And the chemicals that these medications are mixed with, even things like taste, and these even seemingly minor things, for some people can make a difference. So, for example, some people might be sensitive to some of the formulation in one of the nasal sprays. It might even cause a little bit of swelling in their nose.
Right.
And maybe they're not getting that same effect from a different spray. So generally speaking, if a patient tells me that one doesn't work and, they want to try another one, I'm totally not against that. And I think it's totally reasonable to try it because there's not much to lose by trying it.
For sure. And another thing that's changed too is the delivery. And so there are more sensitive sprays that are out there too with different preservatives that tend to cause less irritation for some patients. There are ones now that are these exhaler type devices which deliver the steroid up higher into the sinuses. So for patients with sinus disease and polyps, those other sprays can be more beneficial for them. And so it is a little bit of trial and error for each patient to find which one seemingly gives them the best outcome. But as Dr. Reddy can attest to as well, patient compliance is almost always the biggest thing when it comes to these allergy medications. Yep. And so if a patient doesn't like the taste or the smell of it, and so they don't want to use it every day, that often affects the effectiveness of it, because with allergy medications, it is the kind of the steady usage of a lot of these that helps prevent the big flare-ups when we have allergies.
Yep.
Do you have suggestions as far as patients then, as far as the timing of the year for their allergy medications and starting in the spring or staying on them all the time?
Generally speaking, if you have a seasonal allergy, we tell our patients to maybe use their sprays and their medications consistently throughout that season. And if they have indoor allergies, then it's usually going to be a year-round medication that they're using.
Agreed.
Yep.
Agreed. Yeah, absolutely. Yep. All right. So I think that's been a good just talk and discussion about allergy medications, whether or not you actually do need to switch them. And so that does it for today's episode of We Knows Noses podcast. Be sure to like and subscribe.